Welcome back to Med School Radio, bringing you the best in medicine. Welcome back to Med School Radio. This is Simon here in New York again. So let's start off with a little bit of advice. If you ever thought that you could just shoot through the Q banks very quickly the first time, just looking at the question and skimming over them without really taking them in, you better think again. And if you've heard about people that seem to breeze through UWorld or other Q banks without a care in the world and say it's easy, don't listen to them. They all took the time to go through the Q banks very slowly. Most of them, at least, read the question, read the answers very slowly, and got better and better, and you will too. So let's go ahead and read today's educational lessons. The first one, post-streptococcal glomerulonephritis, is most common in children and presents with nephritic syndrome, for example, renal failure, hypertension, hematuria with red blood cell casts 2 to 4 weeks after an infection with group A beta hemolytic streptococcus. Immunofluorescence microscopy shows granular deposits of IgG, IgM, and C3 in the mesangium and basement membranes. Okay, next one. Irreversible myocardial ischemic injury initiates a series of predictable morphologic changes over the hours to weeks after the initial injury. From 1 and 3 days after the initial injury, neutrophils infiltrate the border zone of the injured tissue, where the myocytes are relatively normal in response to pro-inflammatory cytokines, for example, interleukin 6, 8, eventually migrating to the central portion of the infant. Okay, moving on. Neural tube defects most often occur when the neural folds fail to fuse in the region of the anterior or posterior neuropores. Persistent communication between the spinal canal and the amniotic cavity allows leakage of alpha-fetoprotein, or AFP, and acetylcholine esterase into the amniotic fluid, leading to elevated levels of AFP and acetylcholine esterase that can be detected on amniocentesis. Okay, so that's talking about neural tube defects. Next, let's talk about organophosphates. Organophosphates inhibit cholinesterase in both muscarinic and nicotinic cholinergic synapses, leading to decreased acetylcholine degradation and overstimulation of the corresponding receptors. Atropine reverses muscarinic effects but does not prevent the development of nicotinic effects, such as muscle paralysis. Pralidoxime is a cholinesterase reactivating agent that allows for degradation of excess acetylcholine and treats both the muscarinic and nicotinic effects of organophosphates. Okay. Colchicine. What's colchicine for? Colchicine inhibits tubulin polymerization into microtubules and can be used for acute treatment of and prophylaxis of gout. Important side effects of colchicine include nausea, abdominal pain, and diarrhea. What do you know about hydroxyurea? Hydroxyurea is used in patients with sickle cell disease to increase expression of gamma globulin chains, which leads to increased circulating fetal hemoglobin, or HbF concentration. This reduces vaso-occlusive crisis and symptomatic anemia episodes. Okay, so remember that hydroxyurea reduces vaso-occlusive crises and symptomatic anemia episodes for those with sickle cell disease. Folinic acid, or leucovorin, can reverse the toxicity of methotrexate in non-cancerous cells in the gastrointestinal mucosa and bone marrow if administered at the appropriate time. Leucovorin serves as a reduced form of folic acid that does not require the action of dihydrofolate reductase. Let's talk about asthma. Remember that asthma is characterized by chronic airway inflammation, which leads to airway remodeling, airway hyperresponsiveness, and bronchoconstriction. Corticosteroids reduce airway inflammation and are used for both chronic asthma management, inhaled administration, and acute exacerbations, systemic administration. Adenomatous and serrated polyps, for example, or i.e. sessile serrated polyp, traditional serrated adenoma, are neoplastic polyps that have malignancy potential. Increasing polyp size is the most important risk factor for cancer. Villus histology, and high-grade dysplasia are additional risk factors. Let's talk about nodular glomerulosclerosis. Nodular glomerulosclerosis is characterized by glomerular basement membrane thickening, increased mesangial matrix deposition, and formation of Kimmelstein-Wilson nodules. It is most commonly caused by diabetic nephropathy and indicates irreversible glomerular damage with a rapid decline in kidney function. So that's nodular glomerulosclerosis. Think of Kimmelstein-Wilson nodules and diabetic nephropathy. The resting membrane potential is the difference in the electrical charges across the cell membrane under steady-state conditions. The ions that are most permeable to the cell membrane make the largest contribution to the resting membrane potential. Remember, in general, a high potassium efflux and some sodium influx are responsible for the value of the resting potential, which is typically about minus 70 MVs. Mallory-Weiss tears account for about 10% of cases of upper GI hemorrhage. They occur due to increased intraluminal gastric pressure due to retching, vomiting, or other abdominal straining. Intracellular bacterial organisms such as Legionella pneumophila are primarily countered by the cell-mediated immune response. Intracellular pathogens that replicate within phagosomes, for example, Legionella Mycobacterium tuberculosis, trigger activation and differentiation of T helper subtype 1 cells with subsequent macrophage activation via interferon gamma. Heparin is an indirect anticoagulant that alters the shape of antithrombin, or AT3, thereby converting it from a slow to rapid inactivator of clotting factors. Because antithrombin primarily neutralizes factor 10A and thrombin, patients on heparin have decreased factor 10A activity and prolonged thrombin time or partial thromboplastin time. In contrast, direct oral anticoagulants specifically target a single enzyme in the coagulation cascade, such as thrombin, e.g. dabigatran, a factor 10A, or factor 10A, for example, rivaroxaban. Next one, glycine is the most common amino acid in collagen. The triple helical conformation of collagen molecules occurs due to repetitive amino acid sequence within each alpha chain, in which glycine occupies every third amino acid position. Enterohemorrhagic Escherichia coli, or EHEC, is primarily contracted after eating undercooked ground beef. EHEC produces Shiga toxin, which causes hemorrhagic colitis and can lead to hemolytic uremic syndrome, or HUS. HUS is characterized by acute renal failure, thrombocytopenia, and microangiopathic hemolytic anemia. Children aged less than 10 are at greatest risk. Ototoxicity secondary to loop diuretics usually occurs with higher dosages, pre-existing chronic renal disease, rapid intravenous administration, or when used in combination with other ototoxic agents, for example, aminoglycosides, salicylates, and cisplatin. Hearing impairment is usually reversible, but may be permanent in some cases. Okay, the last one. Neuroleptic malignant syndrome, or NMS, is an adverse reaction to antipsychotic medication characterized by severe lead pipe, rigidity, hyperthermia, sympathetic hyperactivity, and mental status changes. NMS is characterized by severe rigidity rather than the neuromuscular irritability, for example, hyperreflexia or myoclonus, seen in serotonin syndrome. So thanks very much for joining me, Med School Radio. Tune in again. Welcome back to Med School Radio. This is Simon. I'm in New York City. If you're studying hard on this cold night, keep studying. You're going to be successful.